Good morning. Good morning to everyone joining us. Thank you for joining. My name is Marisol Aviña, and I am the Director of Public Affairs at the California Endowment. And I'm very excited to welcome you all to today's Policy Perspectives webinar, What the Inflation Reduction Act Means for Equity in California. Although these webinars are not new, you may have noticed that we have a new look and a new name to identify this virtual space that has brought us together over the past 2 years for policy-focused information and conversations. Policy Perspectives, as we are now calling these webinars, bring policy experts and partners to discuss state and federal policy developments and how they impact our states and communities. Today's conversation focuses on the recently enacted Inflation Reduction Act, a very significant piece of legislation that has impacts on health, climate, and tax policy. But we will not be focusing on everything that's in the IRA, but we will focus on some of the health and climate provisions of the law. And we are very excited about the speakers that we have joining us today. And first, we will be hearing an overview of some of those parts of the new law. And to do that, we will have, he will come on screen in a minute, but we will have Michael Tora from the Raven Group to provide us that overview. And then after that overview, we will be joined by an amazing panel of experts for a moderator conversation. And I want you to know that we will have time for audience questions at the end. So please make sure that if you have any questions or any comments along the way, that you enter those in the chat. Also, we will be sharing all the slides that are shared during today's presentation after the webinar, as well as the recording of this event. So check your inboxes tomorrow for those materials. Thirdly, I just want to note that TCE's Policy Perspectives webinars are nonpartisan, non-lobbying, non-political. They're purely informational learning sessions for all our partners and our staff. All right, so now onto the program, and I am really happy to introduce Michael Tora, who is Managing Principal at the Raven Group, to get us started. Over to you, Michael.
Oh, thank you so much, Marisol. So as you said, this past summer, Congress passed and the President signed into law the Inflation Reduction Act, which is indeed a landmark piece of legislation. And as Marisol said, we have an amazing group of experts and advocates who are going to speak with us about what this law means for equity in California. But before I turn to them, I'm just going to give a very quick overview of what the law is, what's in it, and what it's intended to do. And it's going to be real quick. And it's just going to be 4 slides here. And despite being called the Inflation Reduction Act, I'm not actually going to talk about inflation. This bill was the product of a budget process, the budget reconciliation process. I'm not going to bore you with the details of that. But because of that, I'm just going to begin by looking at this from a budget perspective, right? As you can see, the bill consists of 3 main policy areas, and you heard Marisol mention that as well: climate and energy, health, and taxes. In the first one, climate and energy, the bill makes historic investments to combat climate change. This is the biggest federal investment to combat climate change that we have ever seen. And who knows when we'll have a bill on similar scale again. If this is fully implemented and fully implemented correctly, it's estimated that this new law will result in reducing our carbon emissions by around 40 to 43% by 2030. On health, one of our speakers is going to go into this more deeply, but the law actually does a pretty cool thing. It makes prescription drugs more affordable for those who are enrolled in Medicare. And by doing so, it actually cuts federal spending over 10 years. So it's actually a benefit that pays for itself and then some. And some of those savings are being used to pay for making health insurance premiums in covered California more affordable for a lot of people. On taxes, the bill is focused on making our federal tax system a bit fairer by increasing tax collections from corporations as well as from individuals with incomes above $400,000 a year by funding the IRS to go after those who have been evading paying their fair share of taxes. And that's all expected to bring in about $457 billion to the US Treasury over the next 10 years. So from a budgetary perspective, the net effect of this all is that the bill is expected to reduce the federal budget deficit by about $238 billion over 10 years. This makes the Inflation Reduction Act actually the biggest deficit reduction act that's been signed into law since Bill Clinton's first term in office. So let's go to the next slide. So how are the investments and policy changes in this bill going to show up? Unlike a lot of the recent big bills like the American Rescue Plan Act, the Bipartisan Infrastructure Law, this one, the Inflation Reduction Act, isn't that heavy on grants. They're still there, around $60 to $70 billion worth. And that's certainly nothing to sneeze at. It includes some really promising programs. There's a $3 billion environmental and climate justice block grant program for community-based organizations. There is another $3 billion grant program to improve neighborhood access to transit in disadvantaged and underserved communities. There's a $3 billion grant program to reduce air pollution at ports and a lot more. But most of the monetary benefits of this law are going to flow as direct benefits to individuals and families, as well as tax cuts to industry, to businesses, consumers, and households as well. All right, let's go to the next slide. Here, I really just want to make the point that there's still a lot of work to be done to implement this law. It was just signed into law in August. And the work that still remains to be done is especially true for like the grant, loan, and rebate programs. For each program in the law, Congress assigned a federal agency to administer that money, right? And in some cases, Congress wrote into the law some very specific guidance on rules on how those programs should be run. And in other instances, they were pretty vague. And so now it's up to the federal agencies, because there's many different agencies that have responsibility for the various programs in the bill. They're now responsible for filling in the blanks. And they're going to come up with some of the more precise guidance on how to administer these funds. It's important to note that the vast majority of the grant funds in this law are competitive grants. So unlike the infrastructure law, you've probably heard about like funds automatically going to the state or certain local governments. That's not the case under this law, with one very small exception for states. But it's the vast majority is competitive. So states, local governments, but also nonprofits and others will need to compete, apply for these funds in order to get them. Another important note is that some of these grant programs are going to have a very short lifespan. Some of them are 3 or 4 years that they'll be running. Others will run for the whole 10 years. And in some cases, some grant funds will first go to state or local government or to tribal governments, right? They'll sort of win the grant award, and then they will sort of package that and determine how best to create a local program in order to administer the benefits of that particular program, so that eventually all the benefits come to that green box that you see there on the screen, the beneficiaries, right, which range from households to consumers to businesses, nonprofits, educational institutions, etc. All right, let's go to our final slide. I promised this would be brief. And this is just to provide a sense of timing of how this is all going to roll out. On the grant award side, as I just mentioned, federal agencies have to come up with the specifics on the programs. They're working on that now. I think you'll see that work continue through the end of this year. In some cases, they'll be requesting public comment. And then in the first quarter of next year, you'll begin to see notices going out from agencies inviting folks to apply for these competitive grant programs. And as I mentioned, the grant funding is kind of front-loaded for the first 5 years. That's when most of the money is going to go out the door, but so you can see that green line kind of tapers off as we get towards the end of the decade. For the tax credits, some of them are already available now, actually, for this tax year, 2022, but others are going to come online. A lot more are going to come online next year, and then most of them will be around for the duration of the next decade, and some even go beyond 2031. Again, one of our speakers will speak more about the Affordable Care Act provisions of the law, but basically there's an extension for 3 years on sort of the enhanced enhancements that were made to the Affordable Care Act under the American Rescue Plan. And then for prescription drugs, kind of that orange timeline at the bottom, it's actually a bit more, it's actually kind of a complicated timeline, which is difficult to capture on this one slide, but we're going to include some resources and links as a follow-up to today's webinar, so you can dive into more detail on those. So we can pull down the slides. That's it for the high-level overview. And I know that this is really focused on dollars and some really big dollar figures, but those billions of dollars are basically meaningless if they don't actually help the people who need to be helped most. So now to tell us about how these new resources will, or how they could, be used to impact people's lives in meaningful ways, let me ask our guests to join us. So first, I'm pleased to introduce Veronica Garibay. She is the co-director of Leadership Council for Justice and Accountability. Born in Michoacan and raised in a small farm worker community in Fresno County, Veronica co-founded Leadership Council almost a decade ago. She and her team advocate for policies to ensure that there's equal access to opportunity for all Californians. They work with grassroots community leaders in San Joaquin and Eastern Coachella Valleys to help make sure that these rural communities can influence the policy and resource decisions affecting their lives. Because, as I think you all know, for too long, far too long, federal and state resources have pretty much sidelined these communities. So thanks to Veronica's efforts, these communities are becoming empowered to break that business as usual model, so that those living in poverty can have access to clean water and opportunity and live their lives with dignity. So thank you, Veronica, for everything you do. And so glad that you could be with us today. Next, let's bring up Anthony Wright, who is Executive Director of Health Access. Anthony has been leading Health Access for 20 years now. Many of you know him well. He's a tireless advocate for access to healthcare for every Californian. And he does work in California, but also at the federal level. He's a much sought out expert, and we're so glad that you can make the time to be with us today. He has fought a lot of battles in the past 2 decades. He's scored some amazing victories, not victories for himself, but really victories for people to be able to access, healthcare and life-saving and life-changing care that they need. So thank you, Anthony, for making such a profound difference in so many people's lives and for being with us today. And then our third speaker today and guest is Diane Takvorian, who's the Executive Director of the Environmental Health Coalition based in San Diego. Diane is actually one of the founders of the Environmental Health Coalition and has been its Executive Director for 40 years, which, Diane, I suppose that means that you founded it when you were in elementary school.
Only 12, yes.
Diane has been really a one-woman force of nature for environmental justice, active at the local, state, national, and international levels. And she currently serves on the California Air Resources Board. And I just got to say, Diane, just in general, your work has helped countless people by being able to live healthier lives, by being free from environmental pollutants and toxins. And I don't think it's hyperbole to say that your role in the recent decision by the California Air Resources Board to accelerate California's advance towards zero-emission vehicle technology is really the kind of bold leadership that's going to be transformative, not just for our state, but for the country and the world. So thank you for that, and thank you for being with us today. So I'm going to just start with a really kind of quick round question for everybody, and then we're going to go into some more deeper dive questions. So I just want to hear from each of you, what was your reaction to the Inflation Reduction Act getting signed into law, and what do you see as one or maybe two of the most significant takeaways from it? And I don't know if someone wants to jump in. Otherwise, I'll just call on someone. Anthony, do you want to go first?
I mean, we were very excited about the passage. It was a long road. Some of the things that were in the Inflation Reduction Act, in fact, are things that were not just fought for the last 2 years of the Biden presidency under different names, including Build Back Better, but on the issue of having the government negotiate for the price of prescription drugs, that's a multi-decade fight. The issue of trying to get greater affordability in the Affordable Care Act has been an issue since it was passed 10 years ago, and this is the biggest healthcare reform package since the Affordable Care Act, also known as Obamacare. So we were very excited that it was done, and not for both the policy that it creates, but the real impact of providing help to people in terms of real affordability help that they will get, whether it's getting prescription drugs or paying premiums, and we will talk about that in a little bit.
Yeah. Diane, do you want to go next? What was your big takeaway from this?
Sure. Thanks, Michael, and thanks for the great overview. Really, I really appreciated how you broke it down. I'm just going to make one correction. Not at all a one-woman show. We are a community-based organization. Without our leaders, members, and our board and staff, we would be nowhere. So I get to be here with you, all of you today, and in a lot of different spaces. But always know that we are representing communities who really need things like this bill the most and will benefit from it. But they're always here on my shoulders. So it's great. I want to say, I think, as you said, this represents such a sea change in the policies and priorities that we've seen in recent years. So it's such a welcome development. And it certainly appears to really address some of the challenges that disadvantaged communities have. And I know, as Anthony said, it's been a long battle on many fronts, certainly the ones that I think I'm more familiar with in terms of climate and air pollution. We've all been fighting those battles for many, many years. So it's great to have the federal government stepping in and giving the opportunity for implementation and funding for some of the most ambitious programs that I think California has enacted, where there's good intentions, but not necessarily funding for it. So I think this is going to provide some of that. While we always say California is ahead of everybody else, of course, I don't know that that's always true, and maybe becoming increasingly not true. But we do see something that I don't think is a small thing. And you mentioned the CARB rule that will push out light duty vehicles, zero emission vehicles, and we are providing programs that will help disadvantaged communities to purchase those. But we have not yet had the kind of provision that's in this law, which will provide a tax credit for the purchase of used zero emission vehicles. And I think that's a really huge step, because most folks are not going to be able to afford a new car of any kind, never mind a ZEV vehicle, which is average of $60,000. So I think that's huge. And the only other thing I'll say is, well, this is a lot of money, and I really appreciate you breaking it down, and it's money over a number of years. We don't know how much is going to actually come to our communities, and we don't know how it's going to come to our communities, and whether there'll be a friendly and accessible way for nonprofits and CBOs to get that funding. So those are things we need to look out for to make sure that this has a true impact. And I look forward to talking about more of the specifics as we go forward. Thanks.
Great. Thanks, Diane. All right, Veronica, what was your takeaway?
One significant takeaway, in addition to what Anthony and Diane just shared, is that when political will is there, landmark legislation is possible. And IRA came on the heels of CARES Act, of ARPA, of the Infrastructure and Investment Jobs Act, which is significant action by the federal government to invest in and direct dollars to where it's needed the most. Now, I'll stress that to me that this is, there's a lot of stuff in the bill itself. There's a lot of good, and there's also a lot of not so good that could perpetuate some of the harms from a climate perspective and energy perspective based on the work that we do in communities. But I'll note that this is a floor, and this also gives an opportunity for local and states to build on that. And I think that we shouldn't lose sight of that.
Yeah, thank you. All right, so let's dig into some of the provisions here in the bill and kind of what it does. And Anthony, I'd like to go to you first to help us understand. I made reference to ACA subsidies and such, but so can you tell us a little more about how this law is going to make a difference for people to be able to afford health insurance?
So the top line headline is on this is that for the next 3 years, there is a government guarantee that nobody who buys coverage as an individual needs to spend more than 8% of their income on coverage. That's a pretty big deal. The Affordable Care Act took a pretty big step toward that goal by providing subsidies for people who don't have employer-based coverage, don't have an employer or a government program helping them out with buying coverage. But it asks people to pay 5, 8, 10%, and it cut off that help at 4 times the poverty level. So if you were just over that amount, which is $50,000 for an individual, $100,000 for a family of 4, you could be paying 10, 20, 30% of your income on coverage, especially if you were older in a high cost area, which is a lot of California. During the pandemic, the American Rescue Plan took an important step that we had been calling for, and California was actually modeling on a smaller scale, which is to provide additional affordability assistance so that people that nobody had to, regardless of income, has to spend more than, again, 8.5% of income, and that there would be help both on those higher incomes, but also more help for those with lower incomes. So in fact, there's a lot of people on Covered California right now, the 1.7 million Californians in Covered California, who have $0 or less than $10 premium plans, which is a real benefit. That has actually increased the number of people enrolled in Covered California by over 200,000. The problem with the American Rescue Plan is that was a COVID relief package that was time limited to the end of this year. And so we were fearful that if that wasn't extended, premiums would have risen on average 83%, on average over $1,000 for Covered California enrollees. Now that help is extended for another 3 years, and that sets up an expectation that this is no longer something we're doing in an emergency. This now should be considered the new standard for what it means to provide affordable access to health coverage in California through the Affordable Care Act. And so that's a really, really big deal. This is help of hundreds or even thousands, in some cases, many thousands of dollars for people to be able to afford coverage. And so from the point of view of folks on this call, if you or your clients or your community members are uninsured, and maybe they looked at Covered California premiums a couple years ago and said, I can't afford it, it's not for me, they really should look again, because there's a lot more tangible help for people to afford to get the coverage that they need, and that's a big deal. And for the next 3 years, people can get these premiums at significantly reduced rates based as a percentage of their income.
All right, thank you, Anthony. All right, so that's on health. Now let's look at on the climate side. Diane, I'd like to go to you, and you kind of alluded to some of this in terms of your takeaways, but I'd love for you to elaborate on what you think, to the extent you can say so at this point. What do you think the impact of this law is going to be in California?
Yeah, thank you. It's hard to say at this point because we aren't sure how California will approach it, but we do know that the governor's office has already ramped up and asked former Mayor Antonio Villaraigosa to do a listening tour throughout California. And what it appears to be is very focused on disadvantaged communities. So he and his team are going there and getting advice and getting ideas from communities. They've been in San Diego, and we were able to attend that. So I would hope that everyone will pay attention to that and try to participate in one of those sessions so that community members can really shape this program. I think that's really important. I think the other thing is that the funds appear to be a mix of direct grants that community-based organizations can access, and those that are limited to government agencies, whether they're at the state level or at the local level, like air districts and cities. So I just wanted to note that it seems like, given the work that's been done in California, that those grants and dollars that are available just to government agencies should also be viewed by CBOs, because I'm assuming those are a lot of the folks that are listening today, as accessible for our communities as well. I think that, for instance, there's this the EPA grants that will be for air districts and cities and counties. I think that those that's $5 billion through competitive EPA grants. I think NGOs could absolutely partner with the air districts. Many of them have already partnered on AB 617 projects and other kinds of projects where they should be the implementers for those programs. So I hope that folks will take a look at all of the programs across the board so that they can see where they might fit in. Same thing is true, I think, for the grants to reduce air pollution at ports. These, again, are available to port authorities, to local, state, and regional agencies. And they say certain nonprofits. I'm not sure what that means yet, but we hope that the nonprofits that work in portside communities where pollution from diesel trucks and ships and cargo handling equipment is the worst, these environmental justice communities are experts on this. They've been working on it for decades, and they absolutely should be included, even if those grants can't go directly to them. I hope that we can really advocate together so that they can be included in the grants to government agencies. And then the last one that I thought I just point out is the one that's the block grants for community-based organizations. I think those are open to nonprofit organizations, and ones that I think are really important to focus on. And one of the focuses there is workforce development, which I think could really provide us with the opportunity to push a just transition forward as we're making these transitions to zero emission technology and that kind of thing. So I think there's lots of opportunities. We're just going to have to get out there and be competitive and ensure that our communities have the voice that they deserve in this process.
Thank you, Diane. And that last point about workforce development is so relevant. The Blue-Green Alliance, which is sort of like an environmental labor alliance, had put out their analysis of the bill that it would create 9 million new jobs over the course of the next decade. And the challenge is, who's going to fill those jobs? And if CBOs can make sure that the communities that have so often been sidelined by federal and state resources are able to provide the workforce of the future and that's needed, that would be amazing. So glad to hear that dollars are available for workforce development to be able to help with that. However, the bill is not, just like almost any legislation, because they're always the product of compromise. It's not all milk and honey and rainbows. There's some not so nice things in it. So Veronica, can you tell us, and you alluded to this, how there's some potential risks in this bill, and then maybe we can talk a little bit about also like how maybe some of those risks can be mitigated.
Yeah, happy to. And I think all of you have sort of referenced some of those risks in your comments throughout. And I'll start by sort of identifying a couple of high level issues that merit a lot of attention from groups, environmental justice groups in particular. And I will also start by noting that the Just Solutions Collective has a really great analysis of the IRA from an environmental justice impact that they have published that we can share as a resource following the webinar. But I'll note that there are a couple of things. One, and Diane has noted this also in her comments, is the focus on money. So when we only focus on, there's so much money, there's multi-billion-dollar programs or tax credits, there are grants. And as I said earlier, this comes on the heels of other federal investment packages that we lose sight of the potential impact that those dollars can have. So if targeted in the right way, they can do a lot of good, especially in communities and vulnerable communities that have just experienced the hottest summer on record, that are dealing with wildfire impacts, that are dealing with dry wells in their communities, that are dealing with, really poor air quality in their neighborhoods and communities. And so the risk, so just focusing on the money and the focus on let's go get this money without also talking about what is the impact we want to have? What are the measurable outcomes we want to see that this money can do for communities is important. The other is, the tax, you talked about the tax credits, and, it's a very complicated component of the bill, but there's also a lot of incentives for private sector, subsidizing private sector's ability to invest in alternative energy economies. And there's a lot of risk there. So for example, if you've heard a lot about Lithium Valley and Riverside County and Imperial County and lithium extraction. And so there's a lot of tax credits to incentivize lithium extraction in the IRA, but there aren't accompanying components that would require that as we're looking at lithium extraction, how are we engaging communities, environmental justice communities in particular, in that process? How are we making sure that we're not harming communities, that we're actually reducing air, water, and other pollutants in our neighborhoods and communities? And so those are some of the risks. And then the other, which you've noted a couple of minutes ago, is that there is incredible discretion to federal agencies to establish and design the programs themselves. So while the bill identifies in a couple of places, in a couple of sections, identifies like, here's how this money will go, here's who we're prioritizing, here's what we would want states to develop in order to access this money. There are a lot of caveats out there and carve-outs that give discretion to the cabinet secretaries, that give discretion to federal agencies to define how the programs will be targeted, including how we define disadvantaged communities or environmental justice communities or low-income communities, sort of a patchwork of definitions and non-definitions in the bill that create a real risk for communities. So to address some of those issues is sort of how does California show up in the federal space to make sure that the design of the programs actually benefit communities, that the work that Governor Newsom's administration is leading is done in a way that centers equity and true climate justice, so that dollars are there, that in places where states are allowed discretion on how the dollars ultimately flow to the local level, that we are putting in and targeting dollars to the neighborhoods that really need it the most, that we define environmental justice. And California has led the way. We have Cal EnviroScreen, we have other programs, we have other tools that sort of really try to target resources to communities that need it the most. And we need to be able to do that in order to mitigate some of the risk. And for resources, both grants and tax credits that are being given to the private sector, that we need to be careful not to perpetuate sort of extractive economies that continue to put the burden and impact only on Black, Indigenous, people of color communities in the way that we have done before. So it really requires a very watchful eye at the federal level as these programs are designed. Again, at the state level, as the states, develop applications to seek federal funding to bring it back to the local level. And then at the local level, to make sure that decisions that will target the use of these dollars don't disproportionately impact communities that need it the most.
Yeah, thank you, Veronica. It's just you've provided us with such a good reminder about the importance of implementation, right? Making sure that it's implemented right in order to avoid some of those risks from occurring that you've outlined is just so critical. And you actually teed up very well what my next question was going to be to Diane around the role of the state. And I wasn't necessarily thinking about what you raised in this context. So Diane, I'll leave it to you, but I maybe to make some of the next points, but would love to hear from you on what you see as the role of the California state government in implementation. And ensuring that implementation is successful. And then if you also have thoughts on how sort of community-based organizations and other partners can play a role, we'd love to hear that too.
Thank you. And I think Veronica touched on a lot of the items that I was thinking carefully about. I think that we've worked for decades really to define, for instance, environmental justice communities. CalEnviroScreen is not a perfect tool, but it's probably a more advanced tool than exists in other parts of the country, just because we have more data. So how will the state of California advance that as the framework by which grants will be allocated, and what revisions need to be made to it, or additions or amendments for this purpose to ensure that everyone is included and that it's equitable in rural communities as well as in urban communities. I mean, there's critique, but we have a framework that we can start with, and I think that's super important. I think that we touched on the relationship between labor and environmental justice communities and disadvantaged communities. I think the state can do a lot to promote that through a just transition framework, which is not fully developed, but has a lot of potential within the state framework. And we see it in some of the rules that CARB has moved forward in terms of certification for how zero emission charging facilities go forward and who builds those. Same thing at the California Energy Commission. So I think there's opportunities there. I also think there's an opportunity for there to be a relationship with affordable housing and new alternatives there, even though this doesn't particularly cover housing. We are looking at gentrification in our communities, and we need to look at what the impacts might be of this kind of investment in some communities where it could have unintended consequences of gentrifying communities and displacing people. So those are things I think the state can actually focus on and ensure that they are focused on in each community. And that can be part of, I know that in the Transformative Climate Communities program that the state has, there is a focus on displacement and ensuring that the work that's being done in those in that program isn't displacing folks. That's the kind of consideration that I think needs to be made when these dollars are allocated as well. So I would hope that the state will, one, fight for dollars for California and get them here, but two, will set guidelines that are reflective of the best practices that we have in some of the programs that we already have going, and not allow it to be a free-for-all at the local level, because I think all local agencies are not created equal, but we need folks to have the same opportunity to get access to these funds and to these benefits.
Yeah, thanks. And speaking of those benefits, I'm going to go back to Veronica, and then we're going to go back to Anthony to go back to the health piece of this. But just on that point about getting the benefits, so many of the programs in this bill that have an explicit environmental justice component to them are competitive grant programs. And we know that winning a grant award from the federal government can be a very cumbersome, confusing, kind of intimidating sometimes process to undertake. So would just love to hear from you, like, what's going to need to happen in order to overcome those barriers so that those dollars can get to the communities that need them most?
Yeah, first, I think we need to make sure that the programs at the federal level are not designed in a way that build in inherent barriers and inequity around who can access, what your total budget size has to be in order to qualify, eligibility requirements. We need to make sure, when I first started working in this field was when the American Recovery and Reinvestment Act under the Obama administration came into play, and one component of that bill was a shovel-ready requirement. So the focus was on let's get the money out the door, let's get people to work, let's invest in communities. That automatically eliminated a ton of projects and opportunities in lower income in communities of color, because there were no shovel ready projects, there were no shovel ready concepts. And so, making sure that we're not building in inherent inequities in the programs themselves is step one. And then two, we've partnered with PolicyLink to host a series of listening sessions across the state and different regions in California to sort of understand what do groups need to make sure that we have the capacity and the ability to access these dollars. And we've heard everything from, making sure that there's technical assistance provided to work with, CBOs, cities and counties, public health departments, agencies, to be able to develop and develop ideas or concepts from a concept to actual project stage and make sure that we can draw down on those dollars. The importance of fully understanding the ins and outs of programs that are being created through IRA and how the state will flow, how the state will make sure that these dollars flow to the right places so that we can identify where are the opportunities that we want to engage in and what can we leverage, what already exists that we can build upon to draw down those resources. And then the importance of social infrastructure has come up a lot across California. So how are we learning from one another, learning from organizations working throughout the state who have been successful in drawing down federal resources for communities in the multi-billion-dollar, stages, that we can look to as a model to redirect dollars. And I think that at least in the San Joaquin Valley and the Coachella Valley and places where we work, we're laying the groundwork now. We know that once these programs are designed, just like IIJ, just like CARES Act, those decision makers will look to move those dollars fast for a number of reasons, but they will do that. And so laying the groundwork now and being in coalition to identify and understand the different components of the bill to then identify what are the opportunities that we want to go after and start solidifying those coalitions to be prepared to draw those down, it will be really important.
Yeah. Thank you, Veronica. So I'm going to go to Anthony next so we can revisit the health portion of the law. And before I do that, just a reminder to folks who are watching, please, if you have questions, please feel free to add them into the chat. And then, because we're going to start answering those questions in a few minutes. So Anthony, so you talked about the covered California provisions, the Affordable Care Act provisions of the law. I'd love to hear you kind of tell us more about two other components. Maybe if you want to just share quickly about the prescription drug piece, but also kind of how the achievements that were in this bill fit in to the kind of your overall efforts in California to expand health coverage, accessibility, and affordability.
Yeah, no, thank you for that. I think in the cause to advance health equity, I do want to acknowledge what my co-presenters are talking about, right? That work on climate helps health. Frankly, the work on the tax code helps equity. This was also a big deal in terms of tax reform to be able to have a fairer tax system, which raises money from those who have those means in order to help fund people who are struggling because they are charged more because of their age for health care, because they're lower income and need the help in order to be able to afford coverage, like those subsidies provide. And we do think that this provides a platform for the state to take additional efforts to get us to the universal, affordable, equitable health system that we're trying to build here in California. The Affordable Care Act provides, and now the Inflation Reduction Act provides a framework and some funding, and then we can use that foundation to then take additional steps. So, for example, on the California had a program to provide additional affordability assistance in covered California focused on premiums. Now that the federal government has stepped in, we can hopefully have that conversation about using those state dollars to reduce cost sharing, including getting rid of some of the deductibles and other financial barriers to care that people are dealing with. On the prescription drug side, the federal government is now setting the signal that we can actually negotiate with the drug companies for a better price and not just let them charge whatever they want. And hopefully California and states can take a look at how we can use that as a model for state purchasing of prescription drugs. I do want to also just acknowledge the real tangible benefit of that prescription drug effort. A lot of it is in the rhetoric of having the Medicare negotiate the price of prescription drugs, starting with 10, then going to 20, and more over time. A lot of that is to the benefit of the Medicare program, the federal government negotiating on behalf of the federal government, but that does help fund some very specific program benefits that are very tangible for seniors and people with disabilities in California in Medicare. So, for example, as part of the Inflation Reduction Act, there's now a $2,000 out-of-pocket cap on your prescription drug spending. So for the 115,000 Californians on Medicare who spend over that, they will be capped and covered after they hit that amount. With regard to insulin, their insulin co-payments will be capped at $35. That helps over 300,000 Californians on Medicare. It raises the help that is provided for low-income folks from 135 to 150% of the federal poverty level. And it also makes vaccines free in the Medicare program. And I think many people here know that the COVID vaccine has generally been free, but there's a range of other vaccines, say the shingles vaccine, which costs about $190, that will now be made free. So I want to make sure that, again, folks on this call know that these benefits are out there. So whether it's covered, especially for those in covered California and those in Medicare, there's tangible help that Californians, especially low and middle income Californians, can take advantage now because of this act. And, we want them to. It will help them not just with their family financial situation, but with their prevention in health and wellness.
Great. Thank you, Anthony. That's also encouraging and quite something to think that, this really is the first time that the sort of big pharma lobbying machine has been defeated in federal legislation. So yeah, it's kind of like almost this feeling of the dam breaking. All right, so let's go to the audience questions. Again, if you have a question for any of our amazing panelists, please feel free to put that in the chat. And I see that we already have one question from Francie about if there's any sense yet of what percentage or proportion of funds are expected to be available to nonprofits. And Diane, you addressed some of this earlier. I have, and I'll just jump in and say, just because I've spent a lot of time reading the bill and going through all the different sections and sort of compiling the information, there's one really big program of around $26 billion that's going to be grants that EPA makes to organizations to provide loans to make sure that the benefits of green technology reach underserved communities. So it's basically like those will be given to, I don't know, like CDFIs, community development financial institutions, or other third parties to then figure out how to distribute in a way that gets to communities. So that's, for a very niche kind of slice of nonprofits can qualify for that. Then there's about another $14 billion that nonprofits can apply for. And Diana mentioned how there are some that are specific to like air quality boards and so on, but there is also a role for nonprofits, and there's some where nonprofits can be a partner with either local government or educational institutions or others. And then there's one program stream, and I mentioned that in the beginning, $3 billion for the environmental and community justice block grants. And that's like the only program that puts community-based organizations really in the driver's seat. So nobody else can really apply unless they're doing so in partnership with a CBO. So that's a really exciting potential program. But again, so it's not like there's a guaranteed share for the other programs, but there will be opportunities. But that $1-3 billion program is guaranteed. And just so you know, in the follow-up resources to this webinar, we'll include a link to some analysis and compilation that my colleagues and I did, where we list those programs that I just mentioned as well. Great. So I think we've got. Oh, wait, sorry.
Did can I just add? Yeah, thank you. Sorry. Thank you, Michael. I think that your analysis is awesome, and I hope that you're able to share that. It was super helpful. I don't know that I could answer that question, but I'll just say that there's another, I think, over $3 billion that's available to improve neighborhood access to transit that CBOs can participate in. And I think that this is a really important program that environmental justice organizations and other social service organizations have really been engaged in terms of ensuring that their clients can get to services and really to reducing climate and air pollution. So that's another one that I'm hopeful can be a real partnership between transit agencies and CBOs. So just watch out for that. But I think it's a great question, but it's going to be tough to figure out what portion are going to go to nonprofits, especially if we can really push on the state and local agencies to make some of their funds available to nonprofits as well.
Yeah, absolutely. And then getting those local governments to sort of commit to partnering with CBOs, right, with the money that they get out of this bill. All right, I think we've got another question in the chat from Dave. For those who want to see the climate and energy benefits come to our communities, what should we be doing now to prepare? Oh, this is kind of a perfect segue from what we were just talking about. I don't know if Veronica, do you maybe want to start with that one and then?
Sure. I think the follow-up resources from this webinar will be helpful, and to the extent that different groups can identify resources or analysis that they've already developed to be shared with community groups across the state will be really important. So we have an understanding of what's possible so that then we can identify the avenues to access the resources. So for example, some local governments are already making decisions, whether it's land use plans or short and long range transit plans, as Diane just mentioned, to prepare for increased investment from the federal government. It's important to start engaging in those spaces now and monitoring to see what those decisions are going to be like to make sure that communities are protected. So for example, earlier I talked about Lithium Valley near the Salton Sea in the Coachella Valley region. At the local level, at the state level, the state passed a series of bills that provides funding for environmental impact reports to be done now. So at the local level, we're working with community residents to engage in that process to make sure that as Lithium Valley development continues, that there are protections in place for community residents. And then the other is sort of identifying partners. So knowing that there are some funds for nonprofit organizations, but also the majority of it being through competitive grant applications that will likely require local governments to be an active partner in the development, is to start identifying those agencies that you can work with to draw down some of those resources, or to start working on there's a lot of home rebate programs for energy affordability and energy retrofit in the home, targeting lower income households. And the state, in the most recently approved budget, just approved a nearly $1 billion investment for building decarbonization of existing homes over a couple of years. So there is opportunity to plug in with local networks and organizations that are working to align what the state has just put forward with what will come from the feds to make sure that we're targeting the dollars to the neighborhoods that need it the most, while also creating job opportunities for local communities at the local level.
Thank you. Well, I hope that answered Day. I hope that answered your question. It sounded like very thorough to me. We are almost at the end of our hour, so I just want to ask each of you kind of one quick question, and then I'm going to turn it back to Marisol to close us out. So I'm sure that all the efforts to expand access to quality, affordable healthcare and addressing the climate crisis don't end with this new law or even the fabulous implementation of it. So tell us real quickly, in a minute each, what do you see as next on the horizon that you're going to be working towards? Anthony, do you want to kick us off?
Yeah, sure. So first, making sure that people get the benefit. So whether, open enrollment for Cover California starts on November 1st, in just a few short weeks. So taking advantage of that, like making sure people know that this affordability assistance is out there and at higher levels than it has been in previous years. But in terms of taking these next policy steps, we have resources on our website at www.health-access.org about the federal package and what's in the Inflation Reduction Act. But also on our website is the work about the campaigns to try to build on top of that, to try to introduce greater affordability assistance for cost sharing in Covered California, to try to continue to deal with the cost of care in general with regard to prescription drugs, with regard to high hospital costs, et cetera. What I think this Inflation Reduction Act does is, as hard as it was and as difficult it was, it does show that progress is possible. We can overcome pharma's lobbying. We can get a fairer tax code. We can provide real help, including a government guarantee that nobody has to spend more than a percentage of their income on coverage. And we can get to a universal, affordable, and equitable healthcare system. And if we use the federal foundation that is being provided, we can take those next steps in California.
Great. Veronica, what do you see as next?
Well, as I said earlier, this is the floor. So, one is, as Anthony said, let's make sure the investments benefit people and communities for well-being and quality of life. Let's build the local coalitions at the local and regional level to make sure we're working with state allies and state agencies as the feds develop the program, that the state is doing so, and that the state is centering equity in the process so that we can target those dollars. And then let's build on that. There are local and state dollars available. It's incumbent upon us to sort of figure out, and sometimes help state agencies figure out how to align and leverage resources and target them in the right way.
Great. Thanks, Diane. What do you see as next?
Well, hard to know what else could be said. Anthony and Veronica did a great job. I would just say that this isn't the beginning and it isn't the end. We have a lot that we have developed in California, and I think that we need to not see this as something brand new that we haven't already planned for. Communities have been planning and demanding environmental justice for decades. And there are plans like the AB 617 plans, like community plans, specific plans in local communities. There's air pollution rules that have not been implemented or enforced in the way that they should be. So it's not like we don't know what needs to be done. We do. And folks have been expressing that for a long time. So I would say that we want to build on what folks have said they need for many decades, and also get the state to commit that they will continue these programs beyond the dollars that are available through this federal law. It can't be that, well, that's it, the dollars are gone, so we're not going to fulfill the plans and do the implementation. So I'd say that we're all in this together, and let's make sure that we get to the finish line. Thanks.
Great. Thank you, Diane, and thank you to all three of you. I saw there was one last question about whether there's any funding for homelessness. Unfortunately, that's not an issue that's addressed in this bill. So as we think about next steps, I mean, that certainly in our state continues to be on the agenda, should be on the agenda of what needs to be addressed next. But again, thank you all. Let me turn back to Marisol to close us out.
Thank you, Michael. And thank you so much to the wonderful panel, Anthony, Diane, and Veronica. I feel like I could have gone another hour of listening to you all. I learned so much through this webinar, and I really, really appreciate you joining us today. And to all of you watching, thank you for joining. Please make sure to register for our next webinar that's coming up on November 10th at 10 a.m., which will be focused on post-election analysis and debrief. So we hope you can join us. And we also want to hear from you. We hope that you can take a quick minute to fill out a survey. There's a QR code on the screen. If you have a minute, please scan it with your phone and let us know what you thought and what you would like to see in future events. And again, thanks to our panelists. Thanks to everyone joining us. And we look forward to seeing you on November 10th. And this concludes our program. Have a good day, everyone.